Hi everyone, hope you all are keeping safe and still giving your best in the fight against COVID-19. In this video, I am going to talk to you all about a new initiative of mine in which I am working on the design of a platform to help scientists and researchers make the best use of research available on COVID-19 so as to facilitate the development of drugs, vaccines and treatments for COVID-19. I see this as an area with great potential and one where all of us need to work together and that too most proactively. It is in this context that I decided to talk to you all about it and that too most urgently. But before I discuss about the initiative in greater detail, let me mention why I think designing such a platform is indispensable even in the current context, when there is news about vaccines getting available in India by the end of 2020. As of now, there are 3 vaccine candidates undergoing clinical trials in India. Out of them, the Oxford vaccine is expected to be available for use in India by the end of 2020. The other 2 vaccine candidates, the local vaccine candidates, are expected to have their trials completed by the end of 2020, and if all goes well, they will also be available for use in a few weeks from then. This is good news for all of us. If these vaccines are going to have their desired effect, the country will be free from COVID-19 soon. However, as experts and scientists have pointed out, COVID-19 vaccines are being fast-tracked, not just in India but all over the world. While these vaccines are indeed being tested for their side effects, because even that testing is being done over a shorter period of time, there is no guarantee that we will be able to comprehensively capture all the side effects of these vaccines in all population groups. And when these vaccines are going to be administered in large populations, in a country like India, for example, where we have more than 1 billion people, even one serious adverse event in, say, a population of around 10,000 can cause complications for about 100,000 people. And this is important to consider. It is also worthwhile to consider that vaccine development generally takes few years, and no vaccine against any coronavirus has ever been approved. Of course, at no other point of time in history have scientists and researchers worked together with such urgency on the development of vaccines. And so, this time we expect better results. However, there are other questions also which are yet left unanswered. For example, experts mention that the question as to for how long these vaccines will confer immunity is still largely left unanswered. They point out, and everybody can understand for that matter, that the way to test for how long a vaccine confers immunity is to administer that vaccine and wait till that period of time. So for example, if we want to test whether a vaccine confers immunity for 1 year, we need to administer it and wait for 1 year before we can conclusively say that. All of this is of course not going to happen when vaccines are being fast-tracked. And by the way, everybody can understand the concerns behind fast-tracking of vaccines. Coronavirus has created havoc not just in India but all over the world. And policymakers would certainly like to have some option available with them to prevent people from getting negatively impacted with COVID-19, infected with COVID-19. All of that is well understood. However, it is important for all of us, given the uncertainty around COVID-19, given the potential COVID-19 has to have a disastrous impact on our country and our civilization, it is critical for us to keep working with the scientists and researchers to ensure that we have alternate drugs, alternate vaccines, alternate therapies available for COVID-19 just in case we find some issues with these vaccines. When we talk about drugs and therapies, we find that even as of now, there is no single go-to drug or therapy for COVID-19. If you look at the recoveries that have happened in India over the past many months, fortunately around 76% of the infected people have already recovered, and we hope the number goes up further. But if you look at those recoveries, you will find that there is no single universal treatment for COVID-19 there is no single go-to drug for COVID-19. In fact, what works for one group of people doesn't work for another group of people. So, while plasma therapy works very well for some patients, it doesn't work for other patients. You have doctors who are recommending experimental drugs like remdesivir, hydrochloroquine, tocilizumab, etc. with official approval, and they are prescribing different medications. All this depends on the condition of the patient and the severity of the disease. While this is indeed helpful and has ensured that the recoveries actually are around 76%, this is still a far cry from having a confirmed universal treatment for COVID-19. Given the uncertainty involved around COVID-19, it is critical for all of us to ensure that we remain committed to working with our scientists and researchers to ensure that we have all possible solutions available for COVID-19 which can help us attain a decisive victory. So we have to take this battle to the end. Until this battle is over, there is no way we can relax. My initiative is a step in this direction. The objective of my initiative is to help scientists and researchers in the development of drugs, vaccines, and therapies by giving them more insights on COVID-19. The idea of this initiative is to connect the dots around COVID-19. And how does the initiative attempt to do that? The initiative attempts to do that by linking the tens of thousands of research papers which are already out on COVID-19. So over the last many months, tremendous amount of research has been done on COVID-19, and as a result of which, some 60-70,000 research papers are already available in the public domain. All these research papers contain information about different aspects of COVID-19. Information about genes, chemicals, drugs, vaccines, factors which affect the spread of the disease, factors which impact COVID-19 in general. These research papers are a treasure for us, for humanity, only if we know how to use them best. Because these research papers are essentially disconnected, there is no way we can establish relationship between all these entities expressed in different research papers, even though they may be related. Let me explain what I mean by that with an example. I'll just take the example of any random disease. This is nothing to do with COVID-19 per se. Suppose there is a disease known as disease A, which is caused by a chemical known as chemical B. Now this relationship is captured in a research paper X. Suppose there is another research paper Y, which mentions that chemical B is reduced in the body by a drug known as drug C. And this research paper is the result of research done in some different part of the world. It is quite possible that these research papers are never considered together. And when that happens, we may not be able to establish the relationship that drug C is a possible treatment for disease A. And this is a very simple case where I just talk about one disease, one drug, and one chemical. But in the COVID-19 scenario, you will have hundreds and thousands of such entities which may be interrelated, but because they happen to be present in different research papers, we are not able to extract their relationships. The objective of my initiative is to integrate all these research papers as part of a single unified framework. And I attempt to do this through something known as knowledge graphs. Knowledge graphs are a great way, are a proven way of establishing relationships between entities spread across different data sets by connecting them through nodes and edges. So the nodes represent the entities and the edges represent the relationships between different entities. These entities and relationships are visualized in knowledge graphs through nodes and edges, and when these are extracted from research papers and integrated as part of the knowledge graph, there is a possibility that we will be able to discover several hidden relationships between different entities in COVID-19, and those relationships may also help us in designing drugs, vaccines, and treatments better. There are plenty of these research papers which contain information about suggestions on vaccines and drugs. So lots of researchers have given novel suggestions on design of drugs and vaccines. And these research papers have those suggestions along with entities related to them. But it is not necessary that those entities are necessarily present in the same research paper in which the suggestion is mentioned. It is in that context also that it is important, on one hand, to extract all the suggestions for the development of drugs and vaccines, and on the other hand, to also ensure that the relevant entities are extracted so that we can get a comprehensive picture regarding those suggestions. This too will have to be achieved using knowledge graphs. Now, designing a knowledge graph involves extracting nodes and edges, extracting entities and relationships from research papers. And while this exercise is best done using natural language processing, because of the nature of research papers we are dealing with, because they talk about biology, chemistry, biological processes, because the entities being referred to here are biological, chemical, biochemical entities like drugs, vaccines, treatments, genes, molecules, compounds, processes, phenomena, status, etc. It is difficult to extract all those entities and the relationships between them with great accuracy. So extracting some entities is easy, while for example extracting the names of drugs and chemicals is easy. But it is difficult to automate the extraction of processes, extraction of a status, extraction of phenomena, etc. And while I have been working on this exercise for the last many weeks, I have realized that no matter what you do, because there are times, in fact, there are many cases where we have to rephrase many of the sentences, many of the phrases in these research papers so as to fit them in our knowledge graph. That exercise is best done manually, and it is difficult to achieve it through automation. It is in this context that I have decided to throw this dataset curation exercise open for manual intervention rather than just using NLP. If good results, accurate results were obtained using NLP, I would have gone ahead with that only. By the way, whosoever is working in NLP here, I expect them to reach out to me so that we can work together and improve upon the accuracy of those algorithms. But at the same time, because I've seen the papers, I've seen the content, I've seen that information is present both in text and in graphs and in tables and in pictures, and that is worthwhile information. I've seen that the sentences there are quite complex, they are not quite simple, and the accuracy from NLP methods is not so great. I feel, based on my experience, that manual intervention, manual curation will be easier to do. The steps for manual curation for any research paper are described by me in a separate video, for which the link is posted in the comment section. If each one of us were to take a single research paper and curate it and fill the form required for that by following the steps in the video, and if each one of us were to spread the word for this amongst our friends and our relatives and all those who think will be able to contribute to this, I think we will be able to finish the data curation exercise much faster. Once the data curation is finished, designing knowledge graph really takes no time. Knowledge graphs are a proven functionality. All we need to do is to point the framework, to point the design to the database. As of now, because some research papers have already been curated by me, and I believe some other people are also working on the initiative, there is some data already available. But because the number of research papers is pretty large, we still need to get many more volunteers to help on data curation. It is in this context that I believe that all of us should make efforts in this direction. People, given the uncertainty around COVID-19, given the fact that this COVID-19 has had disastrous impact on our country and the world over, and given the potential that it can continue to wreak havoc further, I think there is no way we can let our guard down. It is the responsibility of all of us to keep working with our scientists and solutions on the design of better solutions for COVID-19. And I think my initiative is one of the ways in which this can be easily done. You don't need to be an expert in biology or medicine. You don't even need to know biology or medicine to be able to contribute to this. All you need to know is English, and you need to have a willingness to contribute. If you follow the instructions described in another video in a proper way, you will be able to do this data curation exercise very easily. And for a single research paper, this data curation exercise is not expected to take more than an hour. And if you spread this exercise over a few days, you can just spend 5 to 10 minutes daily, and you will still be able to complete it in, say, a week at max. People, given the situation around COVID-19, as I mentioned, let us try and put our best in fighting it with all our might. Let us devote every ounce of our energy in fighting COVID-19. I understand each of you is having your own initiative as well, but all of us need to work together. And since this takes only 5 minutes of your time, 5 to 10 minutes of your time on a daily basis, say for about a week, I think you should be able to take out time for this. And I assure you that once we have the database ready, once we have the graphs ready, it will become a great resource for the scientific community, because by making use of this, they will be able to discover the hidden relationships between the entities that are related to COVID-19, and you never know whether the nodes you add, whether the relationships, whether the entities which you add in the knowledge graph from your side, you never know whether those relationships, whether those entities can help in getting new insights which help in better design of drugs, vaccines and treatments for COVID-19, which help in designing of new drugs, treatments and vaccines for COVID-19. I look forward to your contribution and hope we all together can achieve a decisive victory in this COVID-19 war. Thank you. Jai Hind. Take care.